Hi everybody and welcome to this very exciting video on Smart Surgeons. I'm Dr. Neha Rai. I'm the co-founder of Smart Surgeons, and today's topic that we are going to talk about is earlobe repair or ear ring hole which is stretched out, and how do we manage it. So we face a lot of these issues, right? Like there is a stretched out earlobe. You're so scared that if you wear those dangling beautiful earrings, they might actually tear your earlobe and you might actually have an injury. It's a very, very common problem, but the solutions that are available are so many. So which is the right solution? What can you really do about it? So today we have with us Dr. Rajesh Vasu, who's a senior plastic surgeon in Hyderabad. He has operated on hundreds of earlobe repair, and he will tell us what is the right method, what are the options, and why these earlobe repair tears really happen. So, welcome Dr. Rajesh to our episode, and thank you for taking us through all the experience and expertise that you have in the topic. So, my first question to you is that how common is this problem? How commonly do you see this problem in your day-to-day practice? How many women come to you with this issue?
Torn ear lobules, as we commonly call it, or damaged ear lobules because of rings getting cut through the skin, is a very common problem for us plastic surgeons. And we see this in my practice. I see it almost like 15 to 20 women come in a month for getting these problems fixed. And you'll be surprised that this problem affects all the age groups. Now, we have to know what's the cause of this. At times, it could be because of a trauma, wherein the earring gets get caught up in clothing, and when they're trying to pull it, or maybe when it's stuck in a door or something like that, and our women are trying to get out, and everything is tugging on the ear lobule, and ear lobule is a very delicate structure, and it can easily get cut. Now, this is one common problem. The other problem is with age, and we find women, especially after their 40s, they come to us because they are seasoned in the sense that they have worn many kinds of earrings, heavy earrings, the jhumkas and the balis, and as they keep going for more and more functions, this is like a social thing in India. So they have to go, they have to be prepared, and they end up wearing heavier than what they're supposed to be wearing, not knowing that they're aging and the connective tissue in the ear lobules is thinning out. They're not aware of this. So as a result of this, the ear lobule is getting thinner, and the weight of their jewelry is getting bigger and bigger because of the social thing of attending functions, marriages, and stuff. And so we have a whole set of patients, the age range of 20, 25 up to even 60, 65. They all keep coming to us to fix their problems.
Sir, so I have also seen, some videos of some of the doctors trying to repair the ear lobule by applying a glue or some sort of an adhesive and immediately correcting the earlobe. Do you think that's the right choice for a treatment, or is your opinion different from this?
Yeah, I mean, ear lobule is something which which is not a very standardized procedure. I mean, our patients go to general surgeons. They go to the nearest doctor. Could be a general practitioner. They go to ENT surgeon. Now, my take is, as plastic surgeons, we handle things which are very delicate, which are delicate tissues to actually fix. And ear lobule is something which needs to be addressed by a plastic surgeon who can actually deal with not only the short-term concerns which the patient may have, but also preventing a relapse or preventing a tear again. So I think, in my humble opinion, that a plastic surgeon would be the right person to address these concerns. And again, as plastic surgeons, we get asked a lot of questions. Most patients are not aware that this requires some kind of suturing, some kind of a flap surgery. many of them think that the problem can be addressed by something called as a glue, which is an adhesive, and glues are very common for actually in wounds, especially in children, where it's a very very superficial cut, and glues are used there commonly. But when it comes to earlobial repair, the glue will only make the epidermis, the top layer of the skin, actually get together. But what happens to the bottom layer, which is the dermis, that actually doesn't get together. So when the epidermis is sticking, it seems fine, and the dermis is actually it's actually way retracted. And if you're not suturing that, then there's a high probability that there is a relapse, there is again a tear, and again these people come to us. I mean, there's a practical problem which I face when I'm talking to these ladies. They ask me for applying glue, and I vehemently resist. I know that glue doesn't work, and I explain to them why it doesn't work. And if they understand this, I think that's a good thing, because they're looking at long-term results.
So, sir, you are recommending not to fall for these treatments of, superficially putting a glue, trying to stitch it back together without really putting any stitches. But you are actually talking about surgery. So, is this going to take a long time to heal? How fast a woman can get back to her regular routine?
Earlobial repair is it's like going to a parlor. They actually can get back to their routines. I've done so many earlobules. Some of my patients go back to their work. They come back, they come during the lunch hour, they get the surgery done, and again they go back to their respective workplaces. And that's been the scenario in quite a few patients. And there are some women who are more apprehensive. They think that it's a surgery, so let me take rest. That's fair enough. I mean, they can probably rest for that day, and then the next day you can start resuming your activities. The patients can shower the next day. They can keep the whole area clean and dry. They can smear it with ointments, and generally on the 5th day we remove the sutures. And if we are actually making a hole or making a flap surgery, and then the earrings are maybe applied or maybe inserted after maybe 2 weeks.
Okay, so we are looking at least a time frame of 2 weeks. But, a lot of times we actually think about doing the earlobe repair because there's an upcoming wedding, like in a week's time or something. And I want something fast, quick and dirty to just be able to wear the earrings that I purchased for the wedding. So in these cases, how do we solve for this problem?
Right. This is a very common urgent problem which women pose. They have a function which is coming up in the next couple of days, and they obviously when they come up with that kind of a demand, we'll have to think out of the box and give them solutions. So what I do is I do the surgery, but I splint the wound. I splint the area with special adhesive material, so that the earring is actually going through the adhesive material, and this adhesive material is acting like a external support. So with this adhesive material, they can actually go back for their functions, and once the function is over in a couple of days, they can remove the adhesive. And anyway, you have done a flap surgery, or you've done a repair which will probably hold up, and they can resume their routine activities.
So, Dr. Vasu, we are actually talking about surgery here, a surgical repair. And, me or any other woman actually thinks that surgery is very expensive. Plastic surgeons are going to be even more expensive. And I don't want to spend something so much, just to get my ear repaired, right? So, is it expensive, or is the surgery affordable? What is your view?
It's not really that we are plastic surgeons doing it and it's going to be expensive. These are all daycare procedures. They hardly take 10 minutes aside, and quite often we do both the ears at the same time. It's like I said, it's like going to a parlor, getting your stuff done, and there's hardly any pain because of we give adequate anesthesia around the earlobule, barely any discomfort or pain. So one need not worry about how much time they're going to take for recovery, and you can get back almost the same next half an hour back to work. So need not worry about that.
So, Dr. Vasu, I am doing this earlobe repair because I want to be able to wear my earrings again, right? How fast can I, after the surgery, how fast can I start wearing my earrings again?
So there are two types of surgeries that I do for earlobe repair. One is you must understand that the anatomy of the ear lobule is very important, and another problem which we face as plastic surgeons is the earring position is a very mal-positioned position. So these are usually done by goldsmiths when the patient was a child, and they take them to the goldsmith, and goldsmith is just like making those openings wherever they feel they can pierce. So that's not the right way, because sometimes the piercing is way too low, sometimes it's way too forward, which is again bad. So these are some things which we'd like to correct. And let me explain to you in a mannequin. So if you take this as the ear, now normally I like to consider this as a globe. And once you see the center of the globe, that's called the equator. And normally I like to place my ear opening just over the equator, so that in case you wear that heavier earring, it just looks or appears to be in the center. So that's where it should be, not in the front, not way too behind, and not way too low. So that is what I want to convey a message that, first thing is malpositioned ear lobules or ear rings can actually create problems for you. So we do that corrections. We close up the old opening and we reposition this. Now when we do the repositioning in such patients, usually I call them back after 2 weeks, and I use what is called as a PTFE tube, which is like a new ear ring, but it's made of a plastic kind of a material, which I leave it for 2 weeks, so that once I put this, there is skin healing which is taking place inside the tunnel through which it passes. And once the skin is repaired, usually after 2 weeks, I make them wear their earrings. The second set of repair that I do is called the Purdue flap, which is a more elaborate procedure. Elaborate in the sense everything gets done in the next 15-20 minutes, and it is very fine work where a flap is actually created and made to sit like a hammock, and it's on this hammock that the new ear ring will actually sit. So in such cases also I give them at least 2 weeks of time before they can actually wear their earrings. And my recommendation to all women is actually wear the studs or the lightweight earrings initially. Give it at least 3 months time, let the skin heal, let the incisions heal well, and after 3 months slowly you can graduate to a much more bigger earrings according to your choice.
Okay, so basically, on the fifth day, the suture is removed, and then you call them for a follow up on 15th day. You will check for the healing and everything, and for another 15 days you will ask them not to wear any earring. Okay, so that's 5 days plus 15 days, so around 20 to 25 days of not wearing any earrings. And after that they can start wearing some light earring, or you will put them on PTE tube to actually wear the earring, and then on another 15 days to actually start wearing the real earrings, like the regular earrings. So we are looking at a recovery time of 1 month to be able to wear smaller stud-like earrings, and then another 2 months additional. So totally 3 months time to actually get back to wearing the regular earrings, right? Okay. Okay, Dr. Vasu. So also I wanted to ask you, are there any complications associated with earlobe repair, because this is a surgery after all, right?
We don't see complications as such. I mean, those cases that we do, we don't see any complications. Rarely there might be a relapse. Again, that's because of a connective tissue disorder or something like a very poor collagen or connective tissue, where the ear ring can get again can tear the skin and then can cause a relapse. Otherwise, complications are very minimal. But we take a history of the propensity for our patients to form keloids or to form hypertrophic scars. So if this is the case, we warn them that there can be a scarring issue. But this is again on taking history. We warn the patients and then only we do these surgeries. But by and large, I mean, most patients have, like I told you again, it's like a parlor job. You come there and go back. We don't see any problems otherwise.
Wow, so that sounds like a fairly simple procedure with no complications really, apart from, maybe having a very thin earlobe to start with, which also can be solved by using hyaluronic acid and give a more permanent result. So that is very, very encouraging. So Dr. Vasu, towards the end, I would like to ask you, what message would you like to give our viewers when they're considering, treating their stretched out earlobes or torn earlobes? And also, I would like to ask you that for women who have daughters and who are considering to get a ear piercing for their daughter, what is it that they could do so that their daughter doesn't have to face the problem of stretched out earlobes?
The basic thing is to wear as fine a ring as possible. And number one, mainly, is to get the ear piercing done at least by a surgeon or a plastic surgeon. That's the most important thing. So once you get the repair or the piercing done by the plastic surgeon initially for babies, you can be certain that the position of the ear ring is an exact position.
Thank you, Dr. Vasu, for all the insightful discussions and telling us the right way of earlobe repair. Thank you for all your attention, and we will meet you in the next episode with some more insightful discussions. Please don't forget to like this video and subscribe to our channel, because we'll keep talking about all these discussions with renowned medical experts and all the information that we have for you. Thank you. Have a good day.